Welcome to Recovery with Root, a podcast centered on topics surrounding mental health and addiction. Through our Advanced Recovery Institute, a new entity of the Root Center for Advanced Recovery, we are committed to research and training to elevate clinical care. We hope you find this podcast informative, and most of all, we hope that it helps improve the lives of others. Remember, we're in this together, and recovery is possible. Thank you for joining us. Our first episode, visually here to be joining you on Recovery with Root, Dr. Geri-Lynn Utter, our first video guest. Thank you so much for being here today.
Thank you so much for having me, Margot. I appreciate it.
So you are a licensed psychologist. You are from Philly. And just from all the research I've done on you, let's see, you've got a documentary, you've got books, you've got all sorts of things that you're doing. And really, I love the title of your podcast, Mind Over Mayhem, because it kind of speaks to, I feel like, what you are doing, which is demystifying mental health and addiction and showing that it comes in all different forms. And then it's also not something that should be limiting for you in your life and how you can, make yourself something that maybe you didn't think was possible in the past. So I'll let you tell us a little bit more about yourself.
Yeah, well, if you would have asked me, years ago, if I would be a licensed psychologist, I definitely would have laughed, but not laughing at the field, because obviously I love the field of psychology, but just from where I came from and where I was to where I am, it's not something that I ever thought that I would do. So I come from, Philadelphia. I grew up half of the time in Northeast Philadelphia and the other half of the time in the Kensington section of Philadelphia. My dad owned a bar called Utter Nonsense, and that's where the name of the documentary came from, was from my dad's bar, named after my maiden name, my last name. And it was right kind of centralized in the open air drug market that is Kensington. So from as a kid growing up in that environment, I got to see a lot of people struggling. I grew up in the 80s and 90s, so crack cocaine was very big in that area when I was coming up. And then, as you got into the early 90s, you started to see heroin kind of reemerge. It was always there. In Kensington, you can kind of get any drug that you want. That's why they use the terminology open air drug market. So whether you want, a benzodiazepine like Xanax, or if you want cocaine, or if you want crack, or if you want heroin or fentanyl or xylazine, you can kind of, access all of that in that area. Because I was exposed. And a lot of our clientele were working girls, people who prostituted to support their habit, mixed with neighborhood people. So I got a front seat to addiction through being at the bar, but my story starts before that with my parents. So both of my parents struggled with addiction across their lifespan at different times. So my dad was initially addicted to heroin in the late 60s into the 70s. And then he went from what he says, from the frying pan into the fire, and started to manufacture and abuse methamphetamines. So that was my first introduction or understanding of drugs and how it impacted the family, because that left us homeless. My mom and I, when I was very young, when my dad went to prison, and my mother, it had a lot of trauma, we'll say, from being married to my dad and the infidelity. There was a lot of domestic violence. Her home life was difficult at different times. So my mom went from binge drinking alcohol to pills, benzodiazepines like, Valium and Xanax, to pain medication, to Percocet, and then graduated on to becoming an IV heroin user, and then eventually fentanyl, before she got sober from opioids right around 2020. But then, she kind of still struggles off and on with alcohol and benzodiazepines still. And my dad has since passed away. He died of pancreatic cancer in 2010. So my whole life, from the time I was little up until now, I've been front and center and faced with addiction and mental health and, family violence and criminogenic, environment that I grew up in. And it kind of molded a lot of who I am today. But for me, when you're a kid that grows up in an environment where the cards are stacked against you, and I always felt judged. I always felt like other family members, specifically those on my mother's side of the family, because my mom's side of the family, she was the black sheep by way of addiction or by way of drug addiction. I felt judged a lot. and that people thought that I was going to be messed up, quote unquote, like my parents. So I worked really hard to become the opposite and really used that type of what I perceived as judgment to light my fire and stick it up everyone's ass and say, I'm not going to be what you think I'm going to be. I'm actually going to make it and I'm going to prove all of you wrong. So I think that that has been my motivation for a long time, is to destigmatize not only addiction for the person who is struggling, but for the family members, where we're kind of just like along for the ride, and we go through our own trauma and our own journey alongside of our loved ones, but we're kind of overlooked. And that kind of is what inspired me to get into the field, is that I engaged in my own therapy because of what was going on in my family in my 20s. And it inspired me to go back to school, pursue my master's in clinical and counseling psychology, and then my doctorate in psychology, with no intention at all in working in the addiction field. But it was like a magnet. It was literally like, this was me. And like, it was just, I just felt at home. So like, stick me with anybody who's struggling with addiction, stick me with anybody who has any co-occurring mental health concerns. They're my people. So I spent a lot of time in juvenile justice and in the prison system doing what I could to help folks and still do.
That's so inspiring though, because you kind of said you had people looking at you thinking that's the road you're going to take. And unfortunately, a lot of times we know there's a huge genetic component, and also just what you're used to, right? Your habits, what you saw growing up, what's your normal. And I know that with a lot of our patients, or just those who have come to meet in the field and stuff, there is that genetic component. Maybe speak to the person who's listening to this and they're coming from a similar situation, and they feel like, oh my gosh, everything is stacked against me. Like I
Yeah.
can't do that. You're this inspiration for folks who are in those shoes that you were in 20 years ago.
Yeah, listen, I'm still in those shoes. Like I'm still in those shoes today. I had so from a genetic predisposition standpoint, I have an Achilles heel. Both my parents struggled with addiction, and and grandparents, it was more alcohol, things of that nature. And then from an environmental standpoint, because if you look at the neurobiology of addiction, right, there's genetic piece that says, hey, if you have family members that struggle, strike one for you, Geri-Lynn. And then the other strike is the environment in which you grow up. Well, my parents were in active addiction at different times. So I had all this other chaos and stuff that happened. So statistically, I was screwed, like for lack of a better word. But I think I had something, because I've analyzed myself 150,000 times. When you go into, disclaimer, anybody who wants to get into psych and do it right, you have to do your own therapy. So I've been in my own therapy. So that's another thing, get your own therapy. But I kind of analyzed myself, and I had something that I think a lot of people didn't have. And I had a parent, though my dad struggled hard at different times, he stopped the drugs by the time I was about 5 or 6, but turned to alcohol. But I had him in my corner like a cheerleader. My pop was always like, when you're a kid, when you're a teenager, you go through times when you're like, I can't do this, or I'm not good enough. Like we all do, right? We all have this internal monologue that sucks sometimes. We're nasty. And I was like, I can't do this, or, I can't get into this program, or, I doubted myself. My father was like, excuse me? Like, he was very charismatic. Picture this, like, good looking dude, 6'3", very well spoken, even though he dropped out in 9th grade, is, from born and raised in Kensington. And he's like, you can do anything you put your mind to, kid, because like, I believe in you. So having like a parent that is like, I believe in you, and I believe you can do anything you put your mind to. It's like, all right, like this dude really cares about me and he believes in me. So because he believed in me in the way that he did, I in turn believed in myself. So I had that going for me. A lot of kids don't have that because their parents are so caught up, they never have those conversations. And the other thing I had was early education. When my dad got out of prison the first time, he sat me down. I was 5. And he talked about, and I talk about this a lot on podcasts, the monster that lived inside my brain. That was his way in 1985 of explaining what addiction is to a 5-year-old. Today, there'd probably be a lot of people who are focused on nomenclature and language around addiction that would shame my father. But it worked for me because he explained it in a way that I understood. And he said, you're different than other kids. When kids start to ask you if you want to drink or smoke, as I got older, the conversations became more sophisticated. You can't do that, kid. He said, because you got me and mom in you. And you might end up like us. And look at us. We're in a 2-room, not 2-bedroom. We're in a 2-room efficiency. Your mom's cooking on a hot plate. I don't know where the next, like, it's like, we're figuring out how to pay bills. Like, you don't want to be like this. And the way that he explained it, he wrapped me into it. He was like, do you want to live like this? Is this what you want? Because this is not what I want for you. So I think that's what helped me too, was early education from my father, helping me relate to it in a way that I could see its direct impact on me as a child. And then also having a parent, even though he was screwed up in a lot of ways, and even though we battled, and I was so mad, resentful, and angry about the decisions he made as it related to his addiction and as it related to his life choices, I had a person that believed in me. And I think, and it doesn't have to be your parent. It could be your coach. It could be your sponsor. It could be a grandparent. It could be a teacher. Like, when those people are taking the time out of their day to be like, man, like, I care about you and I believe in you, they mean it. They're not bullshitting you. So listen to it because they think you're worth it, and believe a little bit. Like, don't even believe 100% that you're worth it. Believe 10% that you're worth it. And it can go a long way.
Well, that's something, we try to tell everybody is you're not alone. You hear that sentiment all the time. If somebody tragically passes, everyone always says, I wish they knew they weren't alone. I was there for them. When you're in the throes of a crisis, though, it's sometimes a little hard to think about who that person may be if you don't have someone that immediately comes to mind, like your vivid story and, your warm memories of your father. While you did have parents who were active in addiction, you did have parents who clearly still had that love and devotion towards you, which is a blessing, because we know a lot of people, sometimes that addiction changes you. And though your parents may love you deep down, the addiction
Oh, yeah.
itself in a different nasty way.
Mhm.
How would you try to get through to somebody in that situation, maybe doesn't have that support system?
Yeah, so by the time they're kind of in front of somebody like me, right? I'm a mental health provider. Or take, for example, what Sarah Laurel does. She's on the streets, right? She's front and center, and working with people in active addiction. Simply showing up as somebody like me or as somebody like Sarah and being there means a lot. So, like, if you're providing any type of treatment, or if you're just seeing that person, just how you doing? I'm here. If you need something, give me a call. Or, I'm noticing that you're struggling, like, whatever it is, just kind of being consistent for that person, I think can be helpful. Now, consistency is not to be confused with, giving them anything they want while they're in active addiction, but just knowing, like, hey, when you're ready, like, if you're ready or when you're ready, I'm here for you. Like, I'll help you out. Or if they don't have somebody that's ever believed in them, or somebody that's ever talked to them, I'm a huge proponent of treatment, because in treatment you can develop that type of positive rapport with your therapist. For a lot of folks that I work with, as their therapist, I'm the first person that's ever given them any type of positive reinforcement, or that's basically turned around and said, hey man, like, they show you drawings. They'll tell you that when I go to, like, wow, that's really good. And it's crazy how that can change someone. Just giving them a compliment, because some folks have never heard that or had that opportunity. So I really think, for folks who are lost, for folks who don't have a family member or somebody that's close to them in that every day, there's your extended kind of treatment support. Whether it's harm reductionists that touch you and that you see, whether it's a therapist that, mandated or not, that you see, whether it's a medical doctor that you see, whether it's the lady at the food kitchen that you see, people do care about you, even though that you don't think that they do. And if you just learn a little bit how to care a little bit about yourself and understand that you are worth it, even though you've done terrible, horrible things in active addiction, even though you're ashamed and embarrassed and guilty and all of that, if you can just take like a little shiny glitter piece speck out of all the dark and kind of hold on to that for you, a lot of good can happen, because I've seen it happen. So I'm not bullshitting people when I say that I've seen that happen.
Well, and I have a friend who always says that you should smile or say something kind to everybody you pass, because you don't know if that's the only smile or kind thing that's going to be said to them all day. And I
Right.
think what you just said kind of puts in perspective that we are all able to make a difference more than we think, just by
Mhm.
something even sometimes as saying hello, giving
Mhm.
a warm smile, that can go a long way, because maybe they don't even have somebody to smile at them for the rest of the day. So I think you shedding light on that, because obviously as a licensed psychologist, you're able to do a lot more, right? You have the tools and stuff, but
Yeah.
we're not all equipped, right? I'm a marketing director. I don't have the clinical training, but to know that something like that is also helpful, I think helps demystify addiction and mental health, because I think sometimes it's just wanting to feel seen, heard, loved. Now it's just, how do you bridge that gap? And you mentioned Sarah with Savage Sisters, who we're also going to be speaking to, who does a lot of work frontline in the
Mhm.
Kensington area of Philly. And you mentioned harm reduction, and that's specifically what she's doing. The goal with this podcast is to increase awareness. What do you think is another way that we can do that?
I think specifically when it comes to addiction, um, as a nation, we've done a pretty crappy job. And I don't mean that as just a provider or as providers, or I'm not pointing the finger at any one discipline. A perfect example is how we continue to dehumanize people in addiction by the way it's reported. And you were in media, just by the way that it's reported. For example, I was so pissed off, and I continually get pissed off but motivated. I read an article that I think was a New York Post article that kept on referring to people in Kensington specifically as zombies. And I it just if that's not the if that's not the furthest thing from a human, do you know what I mean? Like, I don't, to refer to somebody as a zombie, or zombie like, whatever, it's the same thing. I think that the way that it's reported further kind of puts people in addiction in this like category of like you're a monster.
Mhm.
You're you're gross, you're dysfunctional, you're damaged, you're bad. So that's something that I really think we could do a better job of, is how we educate on addiction, from how it's reported in the media, and not kind of, you know, conceptualizing these people as inhumane or not human, to how we actually, our systems and processes that we have in place regarding treatment. Because though treatment is great, though people may need a medication to help them, with opioids, or though people may need, an SSRI or whatever they need for depression, or a mood stabilizer if they're, bipolar, um, though all of that stuff is great, that's a very small piece of the treatment puzzle, because these folks are psychiatrically complex, but also, the way that they live, and the way they've been living in active addiction has stripped away a lot of their basic resources, having a place to live, the ability to find a job because they have a record, um, education, transportation, food security. So I think we could do a better job holistically of, instead of just saying, hey, get medication, hey, get therapy, that's a small piece of what's needed to help rebuild someone, or give somebody the opportunity to be successful and functioning again. So I think it runs the gamut, the way that we look at these people, I think has a direct impact on how they're treated. So if we looked at them as people and not as zombies, or not as less than, or not as, junkies, or whatever you want to say, that would create a better dynamic or opportunity for more thoughtful treatment, because treatment is siloed. And, people in harm reduction, may not see things the same way as people in the treatment community. Nonetheless, they're both very important, and have to work together. So I think that's a big part of what we need to do better, is just, look at the disease as what it is, a disease. I'm sick of the debate of the choice. Stop with the debate of it's a choice. We have the scientific evidence to support that addiction is a chronic relapsing midbrain disease, just like, congestive heart failure, just like, any other chronic illness out there. So I think we have to run the gamut from media to treatment to the criminal justice system to, political stance to everything. Behavioral health, it all needs to kind of work together, and we all need to get on the same page and stop fighting with each other.
No, and I think having more people like you, like Sarah, like this podcast that helps change that language, that helps bring things to light. I think another thing, you touched on it early on, the co-occurring disorders, is to realize that not only is addiction a disease, but more often than not, the people who struggle with addiction have some type of other issue that's going on, another mental health ailment that is maybe triggering the addiction or came as a result of, but usually one goes with the other.
Mhm.
And I think there's not enough conversation around that too. I think we just see addiction as addiction. Maybe, maybe I'm wrong in saying that, but at least that's how it feels to me from an outsider. Maybe you can speak more to that on your clinical side of things, but it feels like people see addiction as just addiction, and they're maybe not even taking into consideration what maybe led them to that. Was there
Mhm.
something that precipitated that?
Yeah, that's a great question. So I hate, and we do it in the behavioral health field, inadvertently, not intentionally, but it's like drug and alcohol and severe mental health. And I'm like, guys, all of it is in the Diagnostic and Statistical Manual for Psychiatric Disorders. It's all in the DSM. Addiction is a mental health disorder or a mental health concern, just like bipolar is, just like major depressive disorder is, just like anxiety. But again, it's still separated because it's different. It's not different. So that's the first thing. I think we can do a better job of that. The other thing is exactly what you said. Folks who struggle with addiction, the majority of the time, other mental health concerns happen, whether their addiction was a way to self-medicate or a way to deal with undiagnosed anxiety, undiagnosed or treated trauma, undiagnosed or treated major depressive disorder, undiagnosed, or untreated bipolar. That goes hand in hand. So if that's not being treated, the alcohol, the drugs are kind of helping, or you think helping manage that, when it really ends up exacerbating it. The other thing is, okay, let's say things were okay. Nothing major happened. You were an athlete. Couldn't tell you how many athletes, young people, Division I scholarships for football, for basketball, or the pros are looking at them and they completely tear their ACL. So guess what? That's gone. They didn't have anything preliminarily that was evident as far as a severe mental illness, but that trauma of not being able to get that D1 scholarship, or that trauma of not being able to go into the Air Force or doing whatever it is that they were going to do, led to abuse of medications, led to abuse of alcohol, which then created the addiction. So what we have is somebody that was struggling with depression because of what happened to them, self-medicating or using more of the pain medication or drinking. So the point is, yes, chicken or egg, I don't care. A lot of folks that have substance use disorders or alcohol use disorders also have another mental health concern that needs to be addressed. So we cannot address one without the other. And we have to look at the whole person and take the time to learn from them and learn about them in order to treat them. If we just think we're going to get in there and treat everybody the same, we're going to lose as providers and as clinicians, because we're not going to give the best treatment, because we're not giving ourselves the opportunity to learn about our patients and our clients.
It's like referred pain in a sense. You might be pain in your knee, but it's something going on in your back. And if you're only addressing the knee, well, that back problem is still there.
Exactly.
And I like the analogy you use with the athlete. If you think about the moment when that bad thing happened, let's say that person blew out their ACL and their, athletic career is over, and think of how a bystander would feel hearing that. You would feel so bad for the person. You could, sympathize with them and understand why they're feeling that way. But now fast forward 10 years when the person's in the throes of addiction, doing things that are unrecognizable, we don't feel bad for that.
No.
We're not thinking back to when that person got hurt and how anybody else could relate to that. We may not all, grab a needle or pick up or do something, but we all react differently. And I think getting to that root cause, without, pun intended here with the Root Center, but getting to that root cause. And you seem like that's a lot of what your mission is. What are your goals, I guess, next? You got the books, you got the podcast, you got the documentary. Where do you see Geri-Lynn going next in the world of mental health and addiction?
Listen, I don't know. I mean, sometimes I'm like, why am I Like, because you get tired, when you're out here and you're driven by a cause. I'm driven by the cause. This is personal for me, and it's very professional for me because I want to make a difference. Everybody wants to leave their mark, right? We all are in it to help, but we're also in it because it's our passion, right? If my passion was exercise, maybe I'd have an exercise, but so, it all does something for us. So doing this work, though it helps other people, and though that's what I want, that helps me. That helps me too. So I think, I will tirelessly and relentlessly always help somebody who is ready to get help. What I have learned both personally and professionally is that you have to meet people where they are. So, and I know it's really hard to hear and it's devastating to watch because it's like you're watching a fatal car accident. But if you love somebody who's struggling with addiction or even a severe mental health issue like bipolar, and if that person is not ready and they're not motivated to get help, you could lay yourself on the train tracks. You could do anything that you think would motivate them to get help. And for that moment and that day, you may strong arm them into inpatient, right? That may have worked temporarily, but it doesn't work in the long run because the person that you're sitting across from as a provider or the partner that you love or the adult child that you love, if they don't have the motivation or the drive to get better, you can spend your life savings in the fanciest rehab in the world. You can do it all and say it all. And if they're not ready, it will be more of the same. And for me, that's what's been really hard. And it continues to be what's really hard because we can only help if the person's willing to receive the help. So for me, what do? A big part of my mission is helping people like me who have dealt with this. Like I watched my mom more than triple digits go in and out of treatment and not be ready. She did it for everybody else, or she did it because she wasn't feeling well. And, physically she needed a recharge. She did it for all the wrong reasons. And it was hard to watch, and it's still hard to watch because I know that you're not ready and you're not motivated, but there's nothing that I can do. So that's my mission. My mission is to help people, whoever is in active addiction. I'll help you all day long if you're ready for help. Believe me, you can call me at 3:00. Like we will hook it up. But it's also to help the family members understand that it's not their burden, that they don't have anything to feel guilty about, and that when their loved one is ready, that's awesome that you want to be there, but don't force them. Because if you force them, you're going to be left feeling more upset and alone and guilty as the family member than you did when they were in active use. So I think that's a big part of my mission is to help people like me, because I had to go through this for decades myself before I got it. And if I can make it a little bit easier for someone else, then that would make me feel better.
Well, I think, you hit the nail on the head there. It's just having more people out there who are willing to say you're not alone. Whether I know you or I don't know you, you're not alone. So I think you're doing incredible work. I could talk to you all freaking day. Tell people how they can get in contact with you or check out any of your stuff.
So you can go to my website. It's www.drgeri-lynn-utter.com. You can also find me on Instagram. Same thing. My handle's Dr. Geri-Lynn Utter. I'm on Facebook, Dr. Geri-Lynn Utter, Twitter. So you can find me that way. I also have the documentary out, and that it's called Utter Nonsense after my last name, and that's available on Apple TV and Prime Video. And then I was crazy enough, because I'm still nervous about it, to start a podcast called Mind Over Mayhem that will cover all mental health topics, not just addiction. So we talk about everything from sexual dysfunction and divorce to, addiction and, transitioning from, being in college to the real world. So it covers a whole host of topics. I have my sisters who are younger than me helping me host that. And again, that's called Mind Over Mayhem. We just launched our first episode earlier this week, but you can find that on Apple Podcasts and Spotify. So that'll be a cool thing for a lot of folks, and hopefully they can relate to some of the mental health stuff we talk about on that as well.
And I'll have all of that linked in our podcast description. So, and I can say I already listened to episode 1. You and your sisters are hysterical. So give it a listen for sure. I love that, you're kind of trying to do the same mission, just make mental health and addiction accessible to everybody, and know that it's a topic that we can talk about. We can laugh about it. We can cry about it. And, we just got to come together on it. So Dr. Geri-Lynn Utter, thank you so much. This was insightful. This was fun. And I hope to connect with you down the line and see what other amazing things you've done.
All right. Thanks so much for having me, Margot. You were awesome.
You have a great rest of your day. Bye-bye.
Okay, you too. Bye.